Hi, today we are discussing a patient we've seen as in the surgery. So first, we're going to discuss about that patient. I basically introduced myself to the patient and told him I'm training. So we just explain some how we're going to assess the patient, how we're going to take history, and all the details. First, I checked his name and date of birth, confirmed the patient, and asked him if it's okay to call him with his name and stuff. So,
What consultation model did you use for this consultation?
there were 2-3 consultation models, but I used the Calgary Cambridge one because that seems to be more easier as compared to the other consultation models, which include taking the details, assessing the patient, then gathering information, and then we discussed the patient's diagnosis, planning what the treatment plan is, and then closing the session. So that's why it was more easier to introduce.
So tell me a little bit more about the patient and what was the main complaint?
Patient, he was 46 years old, Asian male. The complaint was he had a cough for 3 weeks. He got like green phlegm coming up. He felt a little bit breathlessness and just a bit wheezy. Patient had this complaint for, as I said, 3 weeks, but in the past he said he had intermittent episodes of breathlessness. Mainly when he goes for like a walk or running or exercise, that kind of situation.
So did you explore the eyes, ideas, concern or expectations of the patient?
So yes, basically I did ask him what his concerns are. He has read online some respiratory diseases and stuff. So he was worried about like he may be suffering from any underlying health condition or underlying respiratory condition. So he wanted like proper diagnosis. He wanted thorough examination. That was his main concern.
Can you tell me how did you take the history?
Yeah. So first of all, I asked him how long he has these symptoms. As he said, it's 3 weeks. And I asked him, has he got any past medical history? He didn't have any medical history apart from hay fever. He's been regular medication-wise. He wasn't on any regular medication apart from loratadine and beclometasone nasal spray, which he used like on and off when the hay fever season comes and kicks in. No family history of any respiratory condition. In terms of social history, he said he basically he doesn't drink alcohol, but he does smoke 1 to 2 cigarettes a day. Wasn't a heavy smoker, but that's all mainly his concerns were. In terms of allergy, he wasn't allergic to anything, no food allergies, nothing at all. He wasn't using any recreational drugs, and nothing over the counter, no herbal medication. So in that terms, he wasn't taking anything. In terms of system review, I basically asked him, has he got any chest pains, any swelling anywhere? Generally feeling unwell and stuff, but it wasn't. It was just his chest was more kind of full of like the phlegm, and he was saying cough was the main concern. But again, it was for 2 to 3 days, 3 weeks.
Did you explore about the phlegm color or any fever?
Yeah, so there wasn't any temperature. We took his observations. Observations were normal. Respiratory rate was a bit high, like 23, but temperature was normal. Blood pressure was normal. Oxygen saturation was normal, like 94, 95. And I wasn't concerned from any of those issues and stuff. So.
Okay.
Then I went to respiratory assessment. After taking all the history, went to respiratory assessment. So went through first did end of bed observation, Looking at the chest, there wasn't any signs of chest trauma or any chest drainage. There was mild shortness of breath, I can see, but it wasn't too much. There's no peripheral or central cyanosis, no signs of that. His breathing rate was slightly more than normal, but wasn't too breathlessness. It was, I must say, mild type. Then I looked on his hands. I checked his capillary refill. It refilled within 2 seconds. Pressed it for 5 seconds, so no signs of hypoxia or shock. Checked clubbing of the fingers, and it was fine. Checked his fine tremors, and checked his flapping tremors. No issues in those as well. Then I looked in his neck and head area. Checked his jugular venous pressure. It was normal, nothing, no fluid overload or congestive heart failure type, no issues. No swelling of the ankles and no pitting edema. So that one was fine. Looked in his lymph nodes, supraclavicular. They were slightly swollen. Could be sign of infection. So we'll we'll discuss about further. I've checked his eyes. It was normal, pink. No sign of anemia and stuff. Then looked on his thorax. No changes in color, no muscle wasting, no chest deformities, no spinal cord deformities. Breathing pattern was okay. In terms of palpation, chest expansion was decreased. So again, it could be like maybe signs of asthma related. Tactile vocal firmities was decreased, but trachea was central, so which means no pneumothorax, so the pneumothorax can be ruled out. Then did percussion, tapped the finger on 6 anterior, 7 posterior, ladder shape pattern. In percussion, it was hyperresonant, so again signs of maybe suspected asthma or usually in pneumothorax as well, but pneumothorax we already ruled out because there was trachea was central. Then the last step was auscultation. Listen with the stethoscope, listen to the chest sounds, ask him to take deep breaths. There was reduced vesicular sounds, so there was reduced chestings were done, bronchophony, echophony, and whispered bacterial care. That's also decreased. Observe some wheezing on the chest. So again, going more towards the suspected asthma. There was no fine crackles or coarse crackles, so we can rule out consolidation and pulmonary edema. That can be ruled out.
So, did you check any history of asthma or any
Yes.
smoking history?
Yes, so patient, because patient did smoke 1 or 2 cigarettes, but he wasn't a heavy smoker. There was no asthma in the past, nothing, no asthma related issues. So then we went to diagnosis, keeping in view his situation, green phlegm and heavy chest and a bit wheezy. It diagnosed as a lower respiratory tract infection. There was suspected asthma because of auscultation results and percussion and palpation. So for that one, we're going to be referred him to asthma nurse, so proper confirmation of the asthma. So that obviously being prescriber pharmacists are not very confident or not qualified to do spirometry, but asthma nurse has expertise, so they can do the spirometry to confirm the diagnosis. So refer to them.
Okay, so what was your treatment plan then?
Yeah, so because there was infection, so I discussed with him the few antibiotics, which include doxycycline, clarithromycin, and amoxicillin. Clarithromycin patient we couldn't prescribe because unavailability issue was at that time. Doxycycline patient had in the past and he doesn't want it because patient said he had suffered some stomach issues with it. So we just changed to our focus on amoxicillin. So prescribed for 5 days treatment, 1 capsule 3 times a day. Patient was happy to take amoxicillin capsule. The second thing for breathlessness and wheezing, suggested prednisolone tablets. 5 milligram is again 5 days course, 40 milligram per day. Advise patient how to take them with or after food, and complete the course. Take preferably in the morning time or with or after food.
And did you print and give them a steroid card?
Yes, so we do have available here steroid cards. We filled it, read the dose and all the details on it, and advise the patient in case of emergency they need to present it somewhere, if they have to go to a hospital.
And you're gonna refer him to be booked with the asthma nurse?
That's right, yeah. So in the meantime, for the breathlessness, I prescribed inhaler as well, salbutamol inhaler, prescribed dry powder inhaler, but mainly referred him to asthma nurse so she can do the proper diagnosis and to confirm the asthma.
And did you give any lifestyle advice or smoking
Yes,
advice?
so the patient wasn't willing to give up smoking, but I gave him all the options. I explained to him how dangerous it could be, especially if it's confirmed diagnosis of asthma, then it might end up having issues. So we gave him an NRT and stuff. Yeah. Okay. Thank you, ma'am.